Omicron cases and hospitalizations continue to surge in Wisconsin.
There may be evidence of light at the end of the tunnel, a glimmer anyway, in some parts of the country.
But prolonged waits for PCR test results continue to be an issue. As usual, lots to discuss with UW Health Chief Quality Officer, Dr. Jeff Pothof. Welcome back.
Hi, Dr. Pothof. Good to see you.
Yeah, good to see both of you.
So what's taking so long to get these test results back?
Right. So, compared to earlier in the pandemic, it's not that these tests actually take that long to result once they're on the machine. They come back pretty quickly nowadays. The issue is there's so many people getting PCR tests that when they go to these large laboratories, there can be a backlog in processing them just because a machine can only run so many tests at one time. So we are hearing stories of some people almost reaching, their quarantine period before they get that test result that says, hey, yeah, you were positive.
Some areas of the country are actually seeing a drop in Omicron cases, places like New York City, mostly out on the East Coast. But it's raising the question of, has Omicron peaked yet? And do we know that, and what kind of variables do we have to use to assess whether or not it has?
Yeah, so what we'd want to see is a few more data points in a row that would suggest that cases are coming down, that, rates of positivity are lower. And it looks like if you look at New York and maybe Washington, D.C., there are some data points that are suggesting that maybe they're coming off that peak. Now, next week we might talk and be like, whoa, that was a big mistake. Like we're right back at it. But, that's at least, optimistic. I think here locally, it's a little bit too early to say if we're at peak or coming off peak. But I think over the next week, boy, I'd love to come talk with you guys next week and say, hey, look, we've come down the peak. It looks like we're on our way down. That would be great news.
And we'd love that too. The government's home testing website goes up tomorrow. Is it a good idea to people to try to get those home test kits?
I encourage people to go and look at this, especially if you're someone who really can't afford the home tests or you're having difficulty getting out and finding them. Maybe transportation is difficult for you. Having tests at home is helpful. And I would say, myself and all the physicians I work with, we all have some home tests. And the way it's helpful is, it's hard to find a test. It's inconvenient. You wake up with a sore throat. You're thinking, man, I'm a little bit achy. Could this be COVID? It's a good thing to do to just take that home rapid test and kind of reassure yourself or at least know that it's not COVID. And I think a lot of us are really good minimizers. So if we don't have those tests, we probably say, you know what, it's not that bad. My aches aren't too bad. I'm just going to go to and pick at work or to some sort of event. And we find out that we end up, infecting other people with COVID. So having that positive result usually changes our behavior. We're more likely to stay home, isolate once we know for sure we have COVID. So I recommend people to go check out that website and get your test ordered if you haven't done it.
And are they pretty accurate, those home tests?
The rapid test is fairly accurate in the situation where you've had symptoms, especially if you had symptoms for a little bit longer than, say, like a day or a few hours. It's pretty accurate. If you have like really good COVID symptoms and that rapid test is negative, usually it's a good idea to confirm that with a PCR. But if you have symptoms and that test is positive, you're good, you have COVID.
But if you're exposed to someone who is positive, you don't want to take that rapid test right away, right? You have to, there's a couple of days you want to wait to get the most accurate result. Refresh our memory about what that timeline looks like.
Yeah, so if you're a high-risk exposure, you've been in touch with someone who's had COVID, you want to either wait 3 or 4 days to take a test, and if that situation happens and you're still asymptomatic, no symptoms at all, a PCR test is a little bit better. Or if you were a high-risk exposure and now you've woken up with some symptoms or you have some symptoms, that's an opportunity to take a test, and that's where the rapid test likely could detect you being positive for COVID.
I think human reaction is, oh, I've been exposed, I better take a test quick.
I think it's just knee-jerk, and there's anxiety there too. Like, am I going to get COVID? And there's this desire to just take it right away, but you'll get this negative result, and it really tells you nothing. You need to wait a few days for that virus to replicate so that test can be accurate.
All right. Hopefully we are seeing some light at the end of the tunnel. I think we've been saying that for 2 years now, but
I know.
But like you said, hopefully by this time next week, I don't know, maybe we'll see a little bit of a sea change.
Everybody
fingers crossed.
Yeah.
Yeah, everybody stay healthy, wear a mask.
Absolutely.
Keep well. Doctor, thanks for being with us.
Thank you, Dr. Pothof. Good to see you.
We'll see you next week.
See ya.